All right, welcome to The Explainer. Today we are diving deep inside our most complex organ to figure out what exactly happens during a sudden and often life-changing event, a stroke. Let's get right into it. So, you've probably heard of a heart attack, right? But what about a brain attack? Well, that's really the best way to think about a stroke. It is an absolute emergency where the brain itself is under siege, and knowing what's going on is the first step to fighting back. So, what are we really talking about here? Let's break down the fundamental definition of this critical medical event. Okay, at its core, a stroke is basically a plumbing problem, but in your brain. Blood, which carries all that vital oxygen and nutrients, suddenly just stops getting to a part of the brain. Now, this can happen in one of two ways. Either something blocks the flow, that's called ischemia, or a blood vessel actually bursts, causing a bleed, which is a hemorrhage. Either way, the result is the same. Brain cells start to die. Now, while the end result is a brain in crisis, the cause can be one of two very different scenarios. And it's absolutely crucial to know the difference, because how it happened dictates the entire emergency response. And get this, the breakdown between the two types is pretty wild. The vast majority of strokes, we're talking about 85%, are ischemic. They're caused by a blockage. Only about 15% are hemorrhagic, caused by a bleed. This one statistic tells you so much about why the first thing doctors in an ER are thinking is there a clot and can we bust it? To make this even simpler, just think about the plumbing in your house. An ischemic stroke, that's a clogged pipe. Simple as that. Nothing can get through. But a hemorrhagic stroke, that's a burst pipe. Blood is leaking out where it shouldn't be, and it's causing damage from both the pressure and the spill. Two totally different problems, both leading to the same crisis. Okay, let's look a little closer at those blockages. An ischemic stroke isn't caused by just one thing. A clot can form right there, inside a brain artery. That's called a thrombosis. Or a clot can form somewhere else in the body, say in the heart, break loose, and travel up to the brain. We call that an embolism. There are even some really rare cases where a huge sudden drop in blood flow, maybe from something like a cardiac arrest, is the culprit. Then, on the flip side, you've got the bleed. This can happen when an artery bursts deep inside the brain tissue itself, often from years of high blood pressure. That's an intracerebral hemorrhage. Or the bleed can happen right on the surface of the brain, a lot of times from a ruptured aneurysm. And this one, the subarachnoid hemorrhage, it has a very specific and, frankly, terrifying warning sign. And that brings us to what might be the most critical part of this entire explainer. How do you spot a stroke? Because recognizing the signs is the absolute first link in the chain of survival. The key word you have to remember here is sudden. A sudden weakness or numbness on one side of the face, in one arm or one leg. Sudden confusion, or sudden trouble speaking or understanding what people are saying. Sudden vision problems. A sudden severe loss of balance and coordination. These are all giant red flags that the brain is in trouble right now. And hey, remember that subarachnoid hemorrhage we just mentioned? This is its calling card. A sudden, explosive headache often described as a thunderclap. It's unlike any other headache you can imagine, and it is an absolute top-tier medical emergency. If you or anyone you know ever says this, you don't wait. You call for help immediately, because once those signs are spotted, a clock starts ticking, and it is ticking fast. Every single second, every minute that goes by, more brain cells are being lost forever. This isn't just an emergency. It is a frantic race against time. This is the mantra in stroke care. It's simple, it's powerful, and it is 100% true. Time is brain. The faster a patient can get treatment, the more brain function can be saved. There is absolutely no time to wait and see. So, when a stroke patient arrives at the hospital, the very first priority is just stabilization. It all comes down to the ABCs. Make sure the airway is clear, make sure the patient is breathing, and make sure their circulation is stable. Only after that's handled can doctors move on to figuring out what kind of stroke it is and how to fix it. And this is why that race is so important. For an ischemic stroke, the blockage kind, there are powerful clot-busting drugs that can be given. But here's the catch. There's generally only a 4.5-hour window from when the symptoms started. For bigger clots, there's even a procedure where they can go in and physically pull the clot out, sometimes up to 24 hours later. These are total game changers, but they are completely dependent on time. You know, that whole emergency phase, that's really just the beginning. Surviving a stroke opens up a brand new chapter, one that's focused on recovery, rehabilitation, and maybe most importantly, preventing it from ever happening again. The brain has this incredible ability to heal and rewire itself. It's a process called neuroplasticity. And rehabilitation is how you tap into that power. You've got physiotherapy to help regain movement and strength, speech therapy to help with communication and even swallowing, and occupational therapy, which helps patients relearn all those practical day-to-day skills for living. Now, here's a really vital piece of the puzzle. Many strokes are preventable. The single most important thing anyone can do is control high blood pressure, period. Beyond that, managing diabetes, quitting smoking, and taking medications your doctor prescribes like statins and antiplatelets are all essential steps to protect your brain for the long haul. And that really just leaves us with a final thought. Understanding a stroke isn't just some academic exercise. It's about empowerment. So looking at all of this information, knowing what we now know about the brain and how vulnerable it can be, what's one thing you can do starting today to protect your own?